South Africa's climate conference delegates have raised concerns over the UK's red list because it says it will affect those who are travelling to Glasgow to attend the 26th Climate Change United Nations Summit. Sophie Mokoena, our international news editor, now joins us on the line. Good morning, Sophie, and welcome to the show. Why is this a concern for those delegates?
Remember, Aldrin, for the delegates to be able to attend this climate change summit, COP26 in Glasgow in the United Kingdom, you first have to arrive in the country, then you have to quarantine for 10 days. But secondly, the issue here is that South Africa is part of countries that have been characterized as a part of the red list. The red list, it is around UK saying the vaccines that are administered in South Africa are not accepted in terms of how the processes were done for a country like United Kingdom. Now, the scientists also in the United Kingdom are saying that because South Africa has had two variants, our own beta variant and also the Delta variant, therefore, people traveling from South Africa to the United Kingdom might be carrying those variants. But the problem here is that when you look at the Delta variant, the whole world, all countries currently, the main variant that is ravaging different countries, it is the Delta variant, including the United States of America. Now, when you say because people from South Africa, and South Africa has reported Delta variant and Beta variant, and therefore they cannot, they should be classified under the red list, it is discrimination because we are not the only country that has reported Delta variant and also the Beta variant. A country like Kenya, they did report Delta variant and also the Beta variant. Now, how did you arrive at the situation where you are saying people from Kenya don't have to quarantine? But let's take a listen at what the Minister of International Relations had to say when she was speaking to Shawn Bryce-Peace on the margins of the UNGA.
Okay, we'll try and find that clip. We're just looking for that clip in the meantime. Okay, do we have it? Okay, let's listen into what the minister had to say. Okay, no, this is the tweet, and this is in relation to the Sunday Times article. And let's quickly speak about that, Ms. Sophie. The Sunday Times article where the minister indicates that she should have been more forceful. I remember speaking to the acting High Commissioner, to the UK acting High Commissioner here in South Africa, and he said that there had been conversations with the government and they had been transparent also in their decision making.
You know that the Minister of Tourism, Minister Sisulu, did speak to the High Commissioner, and there was an indication that there will be a meeting to discuss this issue, but not much has happened. And I think it is said that we can't get Minister Naledi Pandor because speaking to the SABC, she was very forthright, saying that this cannot be allowed. And South Africa is clearly saying to the United Kingdom, you have to rescind this decision. You have to remove South Africa from the red list, as you have done with other countries. Particularly South Africa and the United Kingdom has been enjoying relationship that is very sound. And also as part of the G7, they have interacted with President Ramaphosa. South Africa being part of the G20, they are again going to meet in Italy where the G20 summit will get underway, but also at the level of the United Nations. That's where the minister made very strong comments saying UK must rescind this. And the scientists in South Africa are very, very angry because they are the very same people who have warned the United Kingdom previously about the variant that was circulating in South Africa, but also in the United Kingdom. I mean, the sequencing in South Africa is of a high standard, of the world-class standard, and therefore many countries are relying on South Africa, particularly on advice that are related to these variants, and therefore South Africa doesn't understand why this. But also, Aldrin, Africa CDC Director, Dr. John Kenkasong, also emphasized the fact that they want answers from the United Kingdom. Let's take a listen at what Dr. John Kenkasong had to say in this package compiled by Coletta Wanjo.
The United Kingdom says a person in Africa who has received a jab of a vaccine distributed by the United Kingdom will not be recognized as having been vaccinated for the purpose of travel to England. The Africa CDC says this is discriminatory, considering that Africa has been receiving AstraZeneca jabs from the same UK through the COVAX facility and more as donations.
The UK has been an instrumental partner in supplying vaccines to the continent, and which we appreciate. So if in the same token, you send us vaccines and we use those vaccines and you say you don't recognize people that have been immunized with those vaccines, it sends a very challenging message for us, and a message that creates confusion within our own population, and a message that doesn't really speaks to solidarity and cooperation that we all believe are the cornerstones and ingredients for us to emerge out of this pandemic together.
The UK says it is working with countries globally to recognize more vaccine certification programs. Britain's High Commission in Kenya says it is in talks with the government in Nairobi on a system to recognize each other's vaccine certificates. Dr. Kengason warns that such policies will make the pandemic remain a challenge globally.
We have seen that even in countries that are fully vaccinated, the variants come in and challenge that. So it means that we need to really try to be more cooperative and express more solidarity than sending confusing messages that will lead to eventually harming the efforts of what we are doing in Africa.
The continent is far from getting enough vaccine supply. Africa has reported over 8 million cases of COVID-19 and has acquired about 181 million doses of COVID-19 vaccines, reaching just 4% of its population. Meanwhile, the director of the Africa CDC, Dr. John Kengasong, has termed as speculative media reports that US President Biden's administration will appoint him to lead the president's emergency plans for AIDS relief, PEPFAR.
Any nomination by any president is the prerogative of that president, and we have not seen an official announcement from President Biden other than a media report, so anything else will be speculative.
In the meantime, he is pushing for developed nations to send more vaccines to Africa. Coletta Wanjo, SABC News, Addis Ababa, Ethiopia.
Now, Sophie, considering what Waletta is reporting on there, and also the sentiments expressed by Dr. John Kengasong, how then should we understand what the minister had told CNN about political punishment? That this decision that has been taken by the UK seems to be for political punishment.
Yes, you know that the vaccine has become a political issue. In terms of the geopolitics, it's a proxy to geopolitics fights that are taking place right now around the world. For example, you have South Africa using mainly 2 vaccines from United States of America, or the companies that manufacture these vaccines that we are using. I'm talking about Johnson & Johnson and Pfizer are from the United States of America. Then you have, on the other hand, other vaccines that are supported by the United Kingdom, like AstraZeneca. And therefore, this can be seen as also a fight for geopolitics. For example, China is also complaining to say that much as the World Health Organization has approved its vaccines for emergency use, we are not importing the vaccine from China, but it has been approved by the World Health Organization. And the World Health Organization Director General this week very sharp and hard on countries that are not buying vaccines from other countries and only looking north, that is the United States of America. And I'm afraid us South Africa are also a culprit, because we are only getting vaccines from companies that are from the United States of America. Therefore, you can see it's a huge geopolitics also in terms of who gets what from who and when.
Thank you so much for your time. That is Sophie Mokoena, SABC News' international international editor.